COVID's had a huge impact, not on just the population, but on doctors in Ontario, with physicians specifically basically trying to get their hands on every bit of information they could and trying desperately to understand this disease so that we could, adequately prepare, prevent, and protect people from it. And that's where the shutdowns, including physician offices and most of elective procedures in hospitals, kind of came to be, resulting in physicians, sort of, as I said, anticipating the surge and trying to prepare for working in areas that they haven't worked in potentially for years, in case of an emergency situation such as what we saw in New York or in Lombardy, Italy, while trying to ensure that the viability of their practices and their patients' healthcare was still maintained during that time. Because so many of our specialty colleagues are completely shut down, all the outpatient clinics are shut down, it makes it quite challenging to get urgent or semi-urgent care in a timely fashion. And so if we don't have an ability to ensure that we can protect and reopen those offices, what we will see is a lot more morbidity and a lot more emergency cases happening because we simply couldn't get the care in a timely fashion. We need a few things to happen sort of imminently, and COVID has sort of turned the dial on how fast everything needs to happen from a policy perspective. Number one is a continuous flow of PPE while we are sort of in the situation of having a highly communicable disease in the population. The second is widened access to whatever type of virtual technology patients are most able to use. Income stabilization to ensure that the offices that are providing care are able to sustain and maintain the staff and resources they need to provide high quality care. That's the responsibility of the province, is to help us to help the public.